Well, some parents rushed to get their young children vaccinated against COVID as soon as they became eligible last month.
But a new survey finds most parents do not plan to get shots for their children under 5. A new poll from the Kaiser Family Foundation found 43% of parents of children in that age group say they will definitely not vaccinate their kids. Another 27% want to wait and see how it works in other young children. So far, the CDC says only 4% of eligible children under 5 have received at least one shot.
These days, it's really difficult to get, the information you would need to make such a decision.
A slim majority of parents of children under 5 say the vaccine poses a greater risk than the virus to their child's health. 81% are concerned about side effects. The same percentage say not enough is known about the vaccine's long-term effects in children. Most of the parents surveyed say they haven't discussed the vaccine with their health care provider.
That suggests there's an opportunity to educate parents about the benefits, and UW Health's Chief Quality Officer, Dr. Jeff Pothof, is here. Welcome back.
Hi, Dr. Pothof. Good to see you.
What goes through your mind when you see those numbers?
Yeah, I mean, it's a little bit concerning because if you took a group of pediatricians and asked them, are they going to get their kids vaccinated, there's no way that 43% would say definitely not. So I think, there's a lot of decisions we make in life, and some are really important. And this is not figuring out which restaurant I'm going to go out to dinner to or which book I'm going to read next. This is the safety of your child. This is not one to make a decision on your own. You need to talk to your pediatrician if you have any questions and really understand what are those risks, what are those benefits. Don't read it on Facebook, don't go to the internet. Talk to your pediatrician. It's a really important decision.
Yeah, that was startling to hear that most people have not talked to their doctor about it. Put on your parent hat for just a second. You have 2 young girls, 8 and 11. Did you have no concerns at all about the vaccine?
No, in fact, we were in that camp that as soon as it was available, we got it for them. In fact, I vaccinated my 2 girls that first time in the Waunakee school districts. When the boosters were eligible for them, within a couple of days we had gotten them boosted. Clearly, I got a pretty good understanding of COVID, kids, the vaccine, the risks of the vaccines versus the benefits. And for me, it's a split-second decision. We want to get those kids vaccinated.
Talk to your doctor, turn off the internet.
That's right. There's so much out there that can lead you astray, and it can look convincing, but you really need to talk to a medical professional with a decision that's medical in nature and this important.
Okay. Let's talk about the BA.5. It seems to be rampant.
Surging.
80% of the cases in this country are BA.5. What's going on with that?
Yeah, so these viruses, we usually don't see this evolution on such a fast pace, but viruses, either they get better at being viruses or they go away. And what we're seeing with so many people infected are these variants, and each one is a little bit better at being a virus than the previous one. So now BA.5, extremely contagious, very, very contagious, and it does a little bit better job of evading our immune system. Now, the bad news is that means that folks who have recently had COVID or even vaccinated, boosted, if they come in contact with BA.5, they may develop symptoms of COVID. The silver lining is we're not seeing that severe disease this time. So a lot of cases of COVID, not nearly the same percentage of people going to the hospital or going to the ICU. So that's the good news.
What have we learned in the past 2.5 years now about how long you have immunity after you contract COVID? Are people getting infected back to back?
Yeah, there are people who can get infected. I've seen studies that show as short as 30 days. And the problem with this, like everything else COVID, is it's changed over the course of the pandemic. So when we first had COVID and we had people who had natural immunity, we didn't think it was that great, but you at least got maybe 3-4 months of protection. Vaccine protection was very good initially, but the virus keeps competing against us. So the virus keeps on getting better at making us sick. So now we have BA.5, and I've seen 30 days. A lot of the literature would say most people don't get reinfected for at least 90 days, but we're seeing reinfections happen at a more frequent clip than we did in the past.
Is there going to be a BA.6, a BA.7?
Well, I think there will be, as long as we continue to have high transmission, and we might, because I think for the most part, folks are thinking, you know what, if I'm not going to get that sick, I just want to go do my thing, and a lot of people will get COVID. That will increase the speed that we see these variants, and the con of that is we have drug makers trying to create a vaccine that's going to match that variant, but the speed that the variants are changing are actually faster than we can create a vaccine, get it tested, and get it out to the public. So we may have a vaccine for BA.6 or 7 in the fall, but we might be on to BA8 or 9.
What about those at-home COVID tests? Do they test for this variant?
They won't tell you if you have BA5, but they will be positive irrespective of what variant you have. So the only way to know which variant specifically is additional testing that labs do that actually can pull out which specific subvariant you have.
And that's not done automatically?
No, we do a percentage of those, so we have a statistically assured method of knowing what the dominant variant is, but not every single person who gets tested goes on to have that typed.
Well, hopefully we can turn the corner sometime soon. We're back to masks here.
Yeah, I hear you.
All right, Doctor, thank you.
Good to see you, Dr. Pothof.
Stay healthy.
Yep.